For any patient diagnosed with tuberculosis, a potentially serious infectious disease that mainly attacks the lungs and can be spread to other parts of the body, immediate treatment is often recommended. However, for many, the journey to recovery is not often a walk in the park, but one that more often than not leaves them with no option but to default on medication given the pill burden. A move that doctors now see is threatening efforts to combat the disease, ranked among the top 10 causes of death globally that results in multi-drug resistance. When 35-year-old Damaris Wanjiku from Botela area in Nairobi walked into a health facility for checkup after developing common symptoms like fever, headache, among others that would easily be assumed by many, the least of our expectations was to be diagnosed with tuberculosis.
Nilianza kusikia fever, kwa na vomit, headache, so nikadecide kwenda hospitali. TB, normal TB.
And despite being started on medication, her condition deteriorated, making her among the 600,000 estimated new cases of TB patients by the World Health Organization who develop resistance to rifampicin, considered the most effective first-line drug for TB.
Badala ya mwili kurecover, mwili ilikuwa inadhoofika tu.
Damaris is among the multi-drug resistant patients at Bahati MDR Clinic, located in Nairobi's Makadara constituency. She is a beneficiary of the 9-month TB regimen pilot project introduced in the country last year. She completed the therapy and was declared TB-free this year.
HIV positive by birth, and right now I'm diagnosed with TB.
For 24-year-old Kenneth Ngovi, he is still on the conventional regimen that takes up to 24 months of treatment, reason being that he defaulted on his medication not once but twice.
Unaonanga drugs zenye ziko mob, plus kuna zingine maybe a homa manini, as in more drugs after pills kuna hapana. Ka last year venye yangu ilifanyika, niliachanga tu hivyo. HIV, so in a way.
His journey with multi-drug resistant tuberculosis has not been an easy one.
First, ndani pia sick to race, as in kila siku nadungwa, kumaliza chiki right, unaenda chiki left, as in unaweza interchange, lakini hiyo ride hata ungeza kukaa chini by the way.
This is Ngovi before the disease took a toll on him in December last year. Ngovi had a skin reaction that totally changed his skin complexion.
Kuna pia the rashes, na miyangu ilienda extreme, kujipil ngozi the whole body hivyo.
One of the major challenges TB patients face is the pill burden. Judy Mora, a nurse at Bahati MDR Clinic, says the patients have to be monitored to ensure they adhere to their prescription.
I don't think if you'll be having such number of drugs at home, you'll be tempted not to take, But if you have supervision and somebody who knows the importance of you taking the drug and will be able to encourage you.
Other reasons why multi-drug resistance continues to emerge and spread include mismanagement of TB treatment, person-to-person transmission, inappropriate or incorrect use of antimicrobial drugs, use of ineffective formulations, among others. Common symptoms of tuberculosis include chest pains, general body weakness, weight loss, fever, and night sweats. According to the World Health Organization, and despite significant progress being made over the last decades, tuberculosis remains the top infectious killer disease worldwide, claiming over 4,500 lives every day. Hence, the need for concerted efforts to combat the disease.
We have 40% cases we are missing. So where are these 40% cases? They are in the community. So we need to go to the community, screen the community, create awareness about TB disease, and bring more people on board.
Gloria Milimu, K24.